Hi guys, I want to talk to you about how to choose the right LED device to use at home. I've had lots of queries recently on how to choose the device and which specifications to look for. And I feel that there is a lot of information available online and there are lots and lots of devices available as well. So it can be a slightly overwhelming experience when you try and figure out which one to get. But I think the most important thing is to try and understand how LED therapy works. And then there are a few things that, in my opinion, should be considered before you make an investment. So, very simply put, LED therapy works by upregulating cell function through the absorption of energy, which is the energy that we receive from the light. This will then it will instigate a cascade of metabolic functions within the skin tissue that gives us the therapeutic benefit that we're looking for. So, in order to be effective, a certain amount of energy needs to reach the cells and it needs to be absorbed by the cells. So, this will be determined by a number of parameters. The first one is the wavelength. So, the wavelength is in the visible light spectrum, we see different wavelengths in different colors. And the three that have the most clinical evidence and data to support their therapeutic benefits are the red light, blue light, and near infrared light. So out of all three of these, blue light is the shortest wavelength. So it's the shallowest effect on the skin. It doesn't penetrate very deep. It's not absorbed very deep. It just works on the surface level, which is why it's very effective against B. acnes bacteria. So it's great for decongesting skin and for working on acneic skins. And then red light is around about 640 nanometers in length, and this will then naturally penetrate deeper than the blue light. It goes all the way to the dermal layer, which is where our collagen and our elastin and the glycosaminoglycans or the hyaluronic acid is. So this penetrates about 2 to 8 millimeters deep, and it will have a benefit on anti-aging. So the third wavelength is the deepest. That's the near infrared wavelength, and it's more than 800 nanometers long. So it does penetrate very deep in the skin tissue, and it has an anti-inflammatory effect. This is what you would use for relieving anyone of pain, of inflammation. It will also help to regulate pigmentation in the skin. So information on wavelengths will be available really easily when buying any device. The best way to use the wavelengths is to use them in combination. So if a device offers all three, you can treat different levels of skin tissue at the same time. For example, if somebody has inflammatory acne, you can work on the inflammation and the P. acnes bacteria with all three lights. So in combination is possibly the best way to use LED therapy. So the second parameter to consider, which you might not find a lot of information on, is how much energy is the device actually emitting. Now this isn't, it doesn't require you to concern yourself with how many LED bulbs a light has or what the electronics of a device are. But this is more about, it's about the dosage of the light that your skin is receiving. For example, if you're having ibuprofen or a medicine, there's a certain dose that's going to be the most effective for treating your condition. If you have too much, it's going to become toxic. And if you have too little, it's not going to have any effect. So light kind of works in the same way. Whichever device you have should be emitting the right amount of energy. So for someone who's really interested, this from all the research that they've done so far, this would lie between 2 joules per centimeter squared to 10 joules per centimeter squared. And this is information that you probably won't find while buying a device. So the third thing to consider is you've got a fabulous device that's emitting the exact sort of right amount of energy that you need, but how well are your skin cells absorbing the energy? And this is something that's directly related to how close the device is to the skin. So the closer the device, the better the absorption. In fact, the absorption rate is inversely proportional to the distance of the device from the skin. So this means that absorption will decrease rapidly if you move the device away from the skin. So at times, if you have a device that's moved away by 2-3 inches, you might lose the absorption completely. So how do we choose the right device? How do we figure out whether the electronics of a device work properly? How do we know how many bulbs it should have, what the energy output of the device is? So in my opinion, the most important thing to consider while buying a device is look for the approvals. Does a device have medical approvals? Does it have FDA approval? Does it have the CE mark for Europe? In the UK, I guess we're going to have our own standards very soon. But once a device has got FDA approval, it has a CE mark, you know that the actual electronics of the device have been checked. If the manufacturer is making any claims, you know that those claims have been verified before the device has been given approval. I think one more thing that's really important to consider with home use devices is that if a home use device has been given FDA approval, the manufacturer has actually jumped through more hoops than he would have for a professional device. Because when they approve a home use device, it needs to be completely safe as a consumer end device. And when they approve a device for professional use, they know that a clinically trained expert is going to be using the device. So the standards of safety are not as high as they are for a home use device. So you're not if you're buying a home use device, it doesn't mean that you're not going to get the right benefit, or it's not as good a device as something that you would have in clinic. So I would, once you have the approvals, you've checked the approvals, I would say look at the wavelengths of the device. Does it have all three? You can look for the colors of the rainbow in a mask. You could look for green and amber and purple, but there is no clinical data, there is no evidence to support the therapeutic benefits. The three wavelengths that are the most beneficial are blue light, red light, and near infrared. And then along with the wavelengths, I would look at things like what kind of a mask would suit you better. Do you want a hard mask? Do you want a silicone mask that can fit easily? Hard masks can sometimes sit heavy on the temples or on the eyes. And then, what are the manufacturer guidelines for the masks? Do they say wear it 3 times a week for 20 minutes, or do they say wear it every day for 10 minutes? So that's something that you would consider according to what would suit you better personally. So along with this, I would look at, does the device come with any warranties? Where am I buying the device from? Is it a random website where if the device is damaged or I need any after sales care, I don't have anyone to go back to? And I think that it is a really lovely treatment to have at home. It's non-invasive, it has really great therapeutic benefits. It works very well with all other treatments like microneedling, if you're using any derma rollers at home. If you are doing any gentle peels at home, it's a lovely way to, you can use it before a peel, you can use it after a peel. And it's a really brilliant treatment to have on its own as well. So I hope you found this helpful. Do send me a message if you have any more questions, and if you're interested in buying any devices, do get in touch.